Hello.
Hi. Can you hear me okay?
It's just us in the room right now because I can like see who's waiting and I can admit them on my own.
Great. Okay.
Do you know if Yasmeen? I see there's someone with an iPad. I don't think that's her. So I'll just wait.
Okay. Yeah, she's coming on. Let me, you know what? I wonder if I should go on my, hold on, I'll check on WhatsApp. I sent her the link. I'm pretty sure she'll be on in a minute.
Okay.
I'll give her another minute or two. We still have people RSVPing.
Yeah, same. Yeah.
Good. Okay.
Okay. I realized I forgot to respond to your email when you sent me the questions yesterday, but I'm assuming I can use those to ask moderated questions if that's still okay with you.
Yeah, absolutely. And actually, let me give you a few that I forgot to send you.
Will you just drop them into the chat box right now on Zoom? Just to me.
Yep. Yasmeen. Dun, 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 dun. Okay. Oh, Michelle is on. Hi, Michelle. Oh my God, do you hear my daughter in the background?
Yeah, a little bit.
Oh my God, they're like, he's trying to get her out of the house and they're fighting. I'm gonna have to mute myself. Oops.
So there's someone named iPad. Do you think that could be her? Because it doesn't have a name.
Let me ask her. I mean, you can check.
Yeah, I can admit this person.
Okay, try. I just asked her on WhatsApp, but
Okay.
let's see.
Nope, it's not. It's not. Okay.
Here we go. Here are.
Thank you.
I'm kind of a mess. They
No,
came
it's
to
okay. I can read it. Okay.
Let me see if she's on. You see her? She has not responded to me.
No.
Okay. Hi out. Okay.
Lee Road.
Eli, I'm just waiting to let people into the webinar until Yasmeen is on.
Yeah, good call. It's nice that there are so many people waiting already, though.
Yeah.
Mm. Let me see if she's responded to me. What's up?
Okay.
Online.
There's also someone on an iPhone that I could let in, see if that's her.
You can try it.
She's in there. I see her. I'm going to let her in.
Oh, good. Okay, cool. Hi, Yasmeen. Can you hear me?
Hi, Yasmeen.
Hi. Thanks for being with us today. I'm Rachel. Nice to meet you. Oh, I can't hear you. Lebron, will you mute yourself just so that I can make sure? Yasmeen, can you try to speak again so see if I can hear you? Because I can't hear you right now. Can you hear me? Yasmeen, can you hear me?
Are you chatting her? I'm with her on WhatsApp.
Can you hear me? It's weird.
She says she can't hear on WhatsApp. She can't hear.
1, 2.
Rachel, should we let people in?
You should probably
No.
technical.
She's just gonna exit and re-enter.
Okay.
Just let her try to re-enter the room, and then we'll let people in.
You want to write a chat to everyone saying that we're just making sure it means audio is working, and then we'll start in a minute?
No, because they can't see it because they're not in the room. But what they see right now is that they're waiting for the host to either they're waiting to enter, they're waiting for the host to start the meeting. So it's not like they don't know that they're trying to get on Zoom.
I just let her back in.
Okay, cool. All right. Let's see. Okay. Can you hear me? I can't hear you for some reason. Are you on mute? Or it could be an issue with your headphones, maybe? Still can't hear me. Eli, can you speak?
Yeah, Yasmeen, can you hear us?
She
Or
said
do you
she
want to try to?
tried a call and it worked just fine like a few hours ago. Oh.
That makes no sense.
Oh, it says connecting to audio now. There, Yasmeen, can you hear us now? There we go.
Muted.
Yeah, Yasmeen, can you unmute?
I am. Yeah, Yasmeen, can
Yeah,
you hear
yeah,
us?
yes, I am.
Okay. Okay.
Perfect. Thank you.
Okay, there we go. We're
We'll let
gonna
everybody
admit
in.
everybody now. Okay, great.
Oh, wow.
Okay.
Okay. Hello, everybody. Thank you for joining us, and thank you for your patience while we got some technical issues sorted out for a minute there just before we started the call. My name is Eli Cohn-Postel. I am the Director of Israel Engagement at the JCRC, the Jewish Community Relations Council of Greater Boston. Where, thanks to our Boston Partners for Peace initiative, we're happy to provide direct connections to Israeli and Palestinians through our Pathways to Peace web series. So thank you for joining us for this call, which we're doing with the Interagency Task Force and with Dr. Yasmeen Abu Fraiha, who will be introduced to us in just a minute. Boston Partners for Peace at the JCRC is a movement that's designed to connect local leaders and activists to grassroots Israeli and Palestinian peace builders, seeking mutual recognition, dignity, and a just and lasting peace. And we're proud to support a bunch of people on the ground who are working with various communities amongst Israelis and Palestinians and learning from them in the current time about how their work is being affected by COVID-19 and being affected by the current coronavirus crisis. So I'm going to turn it over to Liron Shoham from the Interagency Task Force in just a second, and she's going to introduce Yasmeen. I will say that we'll have a Q&A at the end. So if you have questions, please use the chat box to type in your questions. There's a chat function at the bottom of your screen, at the bottom of your menu, and we'll have an opportunity for you to ask Yasmeen questions towards the end. So Liron, if you wanted to take it away, thank you all for joining us again. And yeah, Liron.
Thanks, Eli. Thank you everyone for joining today's discussion. It's such a pleasure to partner with Boston Partners for Peace, and thank you to Dr. Abu Fraiha for taking time to speak with us. My name is Liron Shoham. I'm Executive Director of the Interagency Task Force on Israeli-Arab Issues. For those of you that don't know us, we're an educational organization dedicated to ensuring that North American Jewish leadership and communities have opportunities to learn about Arab citizens and Jewish-Arab relations in Israel. The current crisis has put a focus on public health and highlighted the role of medical professionals on the front lines everywhere. And in Israel, due to the high percentage of Arab doctors, nurses, and pharmacists, there are 17% of Israel's doctors are Arab, 24% of nurses, and 47% of pharmacists. I don't have numbers for paramedics. Due to these numbers, the Arab contribution to public health and the Jewish work that exists in the field have received unprecedented. Thank you. So the Jewish Arab teams that exist in the medical field have received unprecedented attention as a model for shared society and a symbol for the fact that Israel is experiencing this crisis as a whole across populations. At the same time, the crisis, as we know from experience everywhere, does not affect weak and strong populations the same way. Arab citizens and Bedouin in the Negev especially are by far the most disadvantaged groups in Israel, with higher population densities, lower income levels, and therefore facing additional challenges and risks, both in their efforts to curb the spread of the disease and in the economic impact that they're experiencing. In the Negev, for example, there are about 250,000 to 300,000 Bedouin living there, a third of the population of the Negev, of whom roughly half of the Bedouin live in unrecognized villages with no infrastructure like water, electricity, or internet, making issues of hygiene, social distancing, and access to information really key challenges. Outside of hospitals, Arab medical professionals have also played an important role as trusted figures, promoting and ensuring that peripheral communities have access to information and guidelines and feel a sense of inclusion in the national crisis management. Dr. Abu Fraiha has been involved in preventative medicine in the South for much of her medical career. She's both an internal medicine specialist at Soroka Hospital and the founder of an NGO called Rodina, which specializes in preventative medicine and has unique insights into both of these front lines in the corona crisis. Hopefully we'll have this more of a, as Dr. Abu Fraiha prefers, more of a discussion, but she will present for about 15 minutes and then open up for Q&A. Thank you everyone for joining. Thank you, Boston Partners for Peace. Dr. Abu Fraiha, to you.
So hi everyone, this is really exciting to me, especially that I recognize a few familiar faces, and this is really exciting. As you may be, as you can see, I'm just finishing my shift now in the medical ICU in Soroka, in which I work now. This is our coronavirus critical care unit, and most of my time I spend here. I will tell you a little bit about myself. So I'm as Liron said beautifully, I'm a doctor in Soroka. This is the only hospital in the southern district of Israel, treating both Jews and Arabs, especially Bedouins, because we have about 300,000 Bedouins in the Negev. I am also Bedouin myself, and I am serving at the moment as the chief resident of the internal medicine unit in the hospital. So basically it means that I'm in charge of all the residents and the interns in this major operation of dealing with the coronavirus crisis. And also I founded and I'm directing at the moment our organization that is called Rodina, that deals with preventive medicine. We started with genetics, but today we work on other issues, and for us this event of coronavirus crisis actually puts an emphasis on how much prevention is important, and now people understand what we are saying for almost 4 years now, that if you don't invest in prevention, then it has severe implications and consequences on society and on the medical establishment, and of course the healthcare institutions. I do want to talk a little bit about how we see it in the Negev and in Israel. I am sure that it is very different from what you see in the United States. First, because of the numbers, we don't have as many patients and as many sick people as you may see in the United States. We have in Israel at the moment 12,000 patients who are confirmed with coronavirus. And in my hospital, we treated about a few dozens. In our ICU, we don't treat that many. We treat we treated by now maybe 5 patients, and most of them are not Bedouin. Most of them are actually Jewish, and we believe that it may be because of the differences in socioeconomic status, and because the first wave of patients that we saw were people who came from abroad, and this is something that that is more characteristics, let's say, of someone who works abroad or who travels for work, or people who came from a vacation from Europe or from the Far East. And in the Bedouin community, we don't have that many, because it's a very poor and underprivileged society. So we didn't see any Bedouin patients in the beginning of this period. Now we start seeing them. We had an event or an incident of a family doctor who worked in Ksefe, who wasn't Bedouin, but who was positive for coronavirus. And now we see small outbreaks in specific towns of the Bedouin population. I also want to say that some of the challenges that we encountered was the fact that there were no tests in the Bedouin community, and we only started testing or doing an outreach of the testings about a week and a half ago. So this may explain some of the gaps. I do want to say that this is a very challenging time for me as a doctor and as a person. It's when you talk about Arab-Jewish relationship in Israel, it's a very sensitive issue that usually comes up in national conflicts, let's say, or national crises. And mostly the crises that we see in Israel are political or, let's say, Israeli-Palestinian, mostly security-wise, and create some kind of a bigger national religious conflict. And this is the first time that we are fighting a war, let's say, together, side by side. Because we're all soldiers in what we call soldiers in the army of humanity, and this unifies us together, and we don't feel any difference when we work in the hospital. You know, we work Arabs, Bedouins, Jews together. It doesn't really matter. It's not an issue that we talk about. It's obvious because we all care for our patients and for what we do, and this is something that maybe is important to point out, but actually to me in my daily life, it's something that is really not a non-issue. When we talk about the hospital and what we're trying to do to reach out for the community, this is something that I'm really proud of, being part of this array of people who actually work to reach out to the community. So the first thing that we started doing when we first heard of the outbreaks in the Far East and in Europe is understanding that there is an importance in prevention, as I said in the beginning. And the first thing that we tried to do as a hospital was to reach out to the community, both nursing homes and specific populations in the community that we believed that would be in risk. So one of them, the Bedouin community, but also nursing homes is a very important part of it, because we believed and we knew that the people who are residents of nursing homes are people at risk, and they may be, they can get the virus from doctors or from medical staff, from people coming from outside. We have, my hospital is the only hospital in the area. We don't have any alternative for patients. And we knew that if we're going to get the 10,000 patients living in nursing homes in the area, we won't be able to treat other people. So the first thing that we did was actually send staff members and doctors outside the hospital, which is something that usually is not done, not in Israel and not in any other place, because usually, you know, people are very concerned of their own atmosphere and the places that that they work in, and they don't really see outside of the, you know, the obstacles and the challenges that we have. And today we have a beautiful cooperation together with the municipality of Be'er Sheva. And the second thing that was important to do is, like I said, work with the Bedouin community. And I think what was beautiful to see, and still happens, is that even though we knew that this is a challenge, and this is still a challenge and will be even a bigger challenge because Ramadan is coming in 10 days from now, what was beautiful in the efforts was the fact that because there are so many good people and influential leaders in this community that are working on the healthcare issue and access to healthcare for years, and on, you know, explaining and advocating pro-health measurements, it was actually easier to get people to understand how they should act. And we see this now, that this is really, it's a beautiful thing that the Bedouin community actually adheres to all restrictions that were positioned by the Ministry of Health. And if we were talking 15 or 20 years ago, this would not have been the case, because of the suspicion that we have, or the lack of trust that we have between, you know, this community and the authorities or the Israeli government and establishments. But because we went through this beautiful process of building good infrastructure inside the community, we see today that we don't have as many patients and people who are sick as we thought would be. As opposed to that, maybe I don't know if you've heard, but there's a very significant outbreak in the ultra-Orthodox community, specifically in Bnei Brak and in Jerusalem, in which they don't have the same infrastructure that we have, not the same community outreach, and it's harder for them to get back on track and limit, or what we call flatten the curve. And I think that this is, it may be funny to say, but for me as a person who talks about prevention for a long time now, it's kind of a golden area, because we really see how important it is, first to act in a preventive way, but second, to be always in contact with the community, and not only, you know, deal with specific diseases and with the people who come to my door as a doctor, but also work together with the community, together with people who are being listened to, and understand the needs and understand the challenges. I do want to say that we work on a weekly basis, and actually on a daily basis, but we have a few forums that are in charge of working with the Arab society as a whole in Israel, and with the Bedouin community specifically, together with the Ministry of Health, together with other ministries in the Israeli government. And this is a great achievement, I think, for anyone who works with the Arab society, because from day one, the Israeli government understood that they have to work with the Arab society, and they opened they opened direct channels to speak and explain things to the Arab society as a whole. And this is something that wasn't done before. We have everything explained in Arabic in a very simple way that people can understand. And because of a better understanding of the culture, again, for more than a month now, we are working on what is going to happen in Ramadan. Because we know that this is something that will be challenging because of the let's say the characteristic familiar, or let's say community aspect of it, because people are eating together and are being together all the time. In Ramadan, they're breaking their fast in big dinners, and this may cause more and more infections, and we need to make people understand that they can't do that. And it's really hard. It's like what happened in Passover. So how do you make people understand that they need to be alone and be at home? This is a difficult time. But again, because of the trust that was built previously, before Corona times, it is easier for us. But we will know 2 weeks from now. We still have challenges in the future that we want to that we know we will have, and also already we're starting to see things that people did not expect at the beginning. For example, a friend of mine sent me a picture from this morning, from the post office bank in the middle of Beer Sheva. And you see around it, I think about 100 people. Now, to me, as part of the Bedouin community, I understand that people need to get their stipends because they don't work, because they have a lot of, they get, maternity stipends and other stuff like that. They get it from the post office bank. This is how it is called in Israel. And if they won't get to the post office, they won't get their money, and they don't want to be hungry for food. The people who live in the unrecognized villages they can't get food sent to them online, because these are villages that are unrecognized. They don't have an address to send food to. So we have a task force to send food together with the Israeli military, by the way, to send food to these villages and these homes. But these are things that we didn't think we would have to face at all. But now we have to deal with the fact that people have no addresses, have no money or no salary, and this is also a very important healthcare challenge that we need to deal with. I think this is like just to make you understand a little bit of what is going on in Israel, and specifically in my time for now. And this is without even speaking at all about what is going in the hospital, and how it is really hard for us to deal with manpower when the healthcare system is very deprived, and very, without any budget. We work with whatever we have, and for weeks we worked with no equipment, and no good equipment for keeping us safe, medical staff. But this is just the beginning. I do want to open it for questions. I see that you wrote a lot of things in in the chat here, and I will try to answer. But please, if anyone has a question, I would love to answer.
Thank you, Yasmeen. We'd love to answer everybody's questions. I do want to ask you just a couple of quick moderated questions before we open it up to everybody. A couple of things that maybe you didn't cover. And I was wondering if you could explain maybe like the challenge, more of the challenges in Bedouin society itself related to certain, like you talked about socioeconomic status, but like hygiene practices or like other ritual practices that like make preventing a coronavirus outbreak difficult there specifically.
Okay, so first, thank you for this question. First, we talk about it's a very traditional society. They live in, in big groups, big families. So the size of an average family is about 10 people. And when we talk about people who live in the diaspora, or what we call unrecognized villages, they live in big tents of between 10 to 20 and sometimes even 30 people. So when we talk about quarantine, there is no possibility of these people to be quarantined because they have to live together in this one area that is this big tent. So this is first. Second is it's really hard for them to get isolation equipment or even masks and hygienic stuff like alcohol. It's really hard for them to get, even specifically now in Israel, there's this general quarantine. So because of Passover, we can't even drive from one city to another. So if you don't have a supermarket or you don't have a store in the village where you live in, you are not allowed to get to another village or another city to buy whatever you need. And it's really hard. People need to live with basically nothing. And when we talk about villages with no electricity, no running water, no clean water, they are already at risk to get infectious diseases. We know it from before because the sanitation is bad, and because of the way everything is so crowded. And these are things that we can't really control. The only thing that we can control is how many masks a family has. So this is something that we try to do, but it makes it really hard to prevent. So basically, the best way to do is try to prevent, or try to locate at least the areas where we see outbreaks. So we started working with the Israeli, the Red Star of David, that test people, with their ambulances. They go to houses. They have a big center in Rahat. Rahat is the biggest city in the Bedouin community. So they have a big center in Rahat that was opened a week and a half ago, and they test people there. So we're trying to locate these people and then bring them to and hospitalize them in the hospital, even if they're asymptomatic, just to make sure that they won't infect other people, because we understand that the quarantine conditions are basically impossible. So the tests are really, really important. We have doctors working in the field, people who speak Arabic, to make sure that they understand the regulations and what they need to do. We have a hotline that people can call if they want to ask things. Again, in order to try and prevent infection, because we understand that we can't control the physical conditions. It is a good thing, though, that now the establishment, the Israeli government, that deal with it, understands the consequences. And we do have good cooperation, and suddenly we also have budgets to deal with these issues.
I want to jump in, Yasmeen, and ask you to
Mhm.
you say a few words about there's now a coalition of organizations that's created a situation room for the South that I believe Rodina sits on as well. Can you just say a few words? Because there's several, there's the medical cooperation, there's the government cooperation, and there's volunteers and coordination that's happening locally.
Right. I think that the main leaders in the field are the NGOs. Maybe you're familiar with some of them. Ajik is one of the leaders, Ajik Nisped, and the organization of Bedouin doctors. Rodina is part of them. We also work with Shatil. This is a coalition of health organizations or organizations that deal with health that was established 3 years ago, by the way. And we're working to improve the healthcare system in the Negev and the Israeli periphery for 3 years now. And let's say now is our time to shine, because it's a big crisis that actually no one knows how to solve and how to deal with. And the fact that we cooperate with each other, and one organization, Ajik, for example, is really good with the community. They have solid trust. People know them. They get to everywhere. So it's really hard. It's really easy for them to get basically to any hill in the desert, and people were willing to listen and do what they say. And together with Shatil, who are used to work with the government, and us who work a lot on prevention and very familiar with testing outside of the hospital and bringing good technologies into mobile clinic and make everything more easy outside of clinics. So because this is a really good thing that we already have experience. So this is not our first time, and the cooperation is very synergistic. So this is actually a really good success story. We together we've started this, like I said, the hotline, and also some kind of a we have this I don't know how to call it in English, but kind of a what we call control room. That Ajik is one of the founders, and they sit there probably 24/7 in order to answer to people's needs and people's questions, and give whatever people need. And we are trying to solve anything that comes up.
Thank you, Yasmeen. I forgot to introduce myself to everybody. I'm Rachel Goldberg. I'm the program manager at Boston Partners for Peace, and I'll be asking some of these questions that you all have typed into the chat box. So thank you for entering your questions. I'm just scrolling here. So the first question, here in the US, there are extreme differences among minority communities. What are the infection or death rates in Israel among the Arab and Bedouin communities compared to the Jewish populations? So I think you answered this a little bit in your specific region, but do you know in general maybe a little bit about that?
Actually, I don't know about any Arab citizen who died as a result of coronavirus. Most of the patients, and the vast majority of the sick patients and also the deceased are Jewish. I don't think we have even like when you think of Ethiopians and Druze, the infection rate is really low, and also the death rate is really low. There might be some biases. So one of the biases is the fact that they're not being tested. If you don't test people, they may be sick, but you don't know that. It won't affect the death rate though, because we do believe that someone, when they feel bad, they come to the hospital. So we don't see higher death rates, outside the hospital or outside the clinics. But, as a doctor, I must say that we don't really know a lot about this virus, and maybe there are many asymptomatic carriers that we don't know about. So because minorities are not being tested, that we can't really know what the infection rate is. Still, as I said before, the specific minority case that is special in Israel, and this is the ultra-Orthodox community. And I think, let's say the public interest in this community rose because of, we know that an airplane came from Brooklyn, actually, with many people from the ultra-Orthodox community, and 65 of them were positive to COVID-19. And after that, we saw a big outbreak in Jerusalem and in Bnei Brak. And during the holidays, the whole city was shut down. I don't think that the treatment that this community in the center of Israel gets the attention they need. But because I'm not really in it, and I don't really understand fully how it works there, I can't really judge. And so, but we do know that they don't have enough. They don't have, let's say, the infrastructure and and what they need from the medical establishment. They don't get enough outreach, as you see in other places.
Thank you. Our next question. Have all Israeli hospitals reached out to nursing homes like you did at Soroka? What is the corona death rate at nursing homes?
So this is also a big issue. Actually, no one has done that. No one in Israel. I don't think in the world. We don't have any reports on hospitals working in, or hospital teams working in nursing homes. This was a big challenge because the infection rate in nursing homes is very high, and also the death rates. In Be'er Sheva, one of the first nursing homes that in Israel that were affected was a nursing home in Be'er Sheva, and by now 12 residents have died. Some of them in Soroka, some of them in the nursing home. But the fact, it was really sad to see that the beginning of this event, that the nursing home staff was, they felt alone. They felt that they don't have enough support from the Israeli Ministry of Health, and some would say because you have to allocate your resources, and if you don't have enough, then you would allocate them to people that with better prognosis or better chances of surviving the disease. But still, we decided in my community and in my hospital that this is our obligation. We can't forget our elderly people just because of their age or just because of their physical condition. And we understand that most of them shouldn't be intubated and shouldn't be in intensive care, but we still have to treat them. And because their staff had to be quarantined because the patients were positive to COVID-19, they had to be replaced. So the easier thing to do was to say, our hospital, we have our things to take care of. But once you understand that we are all one community, we're all, one one society or one human tissue, if you'd like, then we have to take care of people even outside of the hospital. And this way, we're not only taking care of our elderly in the nursing homes, we're also taking care of other people, the healthy people that are not being infected, and the younger people who need the beds in the ICU and get them, because we have enough people to treat, to also go to the nursing homes and treat them, and trying to maintain the infection there and not make it spread. I do want to say that it raised up a lot of ethical dilemmas also on how to help families say goodbye of their loved ones who have COVID-19. This is also something that is very, very, it's hard for me to say unacceptable, but that was not done in other places in the world, because this infection is perceived as something very severe that can really damage or risk the public health. So it's really hard to let families be with their loved ones in their last hours or minutes, but for us it was obvious that we have to do that. We have to let people say goodbye. So it's a very, very difficult dilemma, but we have decided that this is our obligation to make sure that that we can do that they can pass away with dignity and with their family surrounding them, and we will take all measures in order to make sure that this will happen, whether inside the hospital or outside the hospital.
Thank you. Our next question, how much of the Bedouins' community reaction and behavior during the crisis is attributed to the work that Rodina has done in community education over the past 4+ years?
So thank you for this question. So, but I can't really take, we can't take all credit. There are so many organizations that are doing wonderful work in the Bedouin community for years. And I think that thanks to the work that everyone is doing, we were able to be ready for this crisis. We were talking about making information more available and tests more available or accessible. We were talking about accessibility to healthcare for a long time, but we were helped by other organizations that I mentioned before, and I think that the fact that the Bedouin community has people to lean on and to talk to who speak their language and understand their culture made it easier for us to enter this crisis, and the solution was actually, I can't say it's easy. We're still in the middle of it, and I don't know what's going to happen a week from now. But it's really good to know that we have people to work with, and that the community counts on us. So it's an amazing achievement, in my opinion, that this community that can be, some of them are illiterate, and some of them don't have access to the internet, for example, can still comply with the regulations of the Ministry of Health, and can still comply with the quarantine regulations, and if they physically can, and this is really not taking for granted. I think the work that the NGOs have done in the past decade is to be thanked for, because this is the only reason why it works now.
Great, thank you. There's a couple more questions. I'm not going to ask them in order, but I'll get to all of them. So the next question is, how is Israel planning to get back to work? What is the testing situation like? What is the outlook?
So this is a good question. We don't really know yet. I still don't know how we are going to work, like I said, a week from now. But the promise was that after Passover, the country will start coming back to to the routine, but it will be gradual. We started talking about opening the education system, maybe the kindergartens first, and then slowly but surely other classes or other schools. There has been talks about also opening specific shops or malls or businesses in order to get the economy running again. But nothing is confirmed yet. Actually, this morning the government decided to harden the quarantine regulations. We have severe shutdown until, because I guess it's because of the holiday. So today is the end of Passover. Tomorrow is the Moroccan Mimuna, which is a big holiday in Israel. So we have actually a very, very hard quarantine and shutdown until Thursday morning. And it may be actually, they may lengthen it until Sunday morning, but we don't know yet. But the idea is actually to start opening businesses next week. I believe that maybe the shutdown will continue until the beginning of Ramadan, because there's a big fear. We're talking about 20% of the Israeli population is Arabs, and of the 20%, about 80% are Muslims. And like I said, Ramadan is a big issue that I'm not sure the country knows how to deal with. So I believe that maybe they will wait until the beginning of Ramadan to see that people are complying with regulations, and then maybe we will see gradual coming back to routine. And about the testing that you were asking, we have tested, as I know, over 100,000 people by now, which is not a lot, but it's, when you think of as a percentage of the Israeli population, it's about 8.5 million. It's about 15%, something like this. So and we had a period of shortage of reagents and shortage of equipment, but I believe that it will be better after the holiday.
Okay, great. And just the last question is, what do you identify as the biggest challenge right now going forward?
Going forward, I really do think that the biggest challenge is what happens once people come back to their daily routines and there's no shutdown anymore. I think we will face a very hard recession. We will have economic problems. We already have almost 1 million out of the 8.5 million Israelis. About 1 million are unemployed at the moment. because they were fired or they were taken out on, on a unpaid leave because of the crisis. And I think this is going to cost us for sure. I don't know how, but it will also have its health consequences, and of course social consequences. And of course, if I may remind you, we still don't have a formal government, even though we had elections a few, can't even remember. I think it was a month or so ago. We had so many, so it's really hard to keep track. But we still don't have a government. So I think this will be the biggest challenge. I do want to say that the Israeli healthcare system, although I do have a lot of criticism as a person working in it, I think deals pretty well with this crisis, and we still don't have, the hospitals are not overflowing with patients. So we can deal with it, but we don't know what is going to happen once people will come out of their houses, and we will see more infected people and more people who are sick or depressed because they don't have jobs, and they don't know how to pay for their rent or food or other things. And I'm not sure we have a good plan on how to solve it or how to deal with it later.
Understood. Well, I think we're just about out of time. So I wanted to go ahead and thank you very, very much for your presentation today and taking the time to speak with us. Yes. And there have been some great comments in the chat, and people have asked great questions. And so I really appreciate everybody coming onto this call today. And please, we wish you all the best, Dr. Abu Fraiha, in continuing your amazing work and getting Israel and the Bedouin community through this crisis. So thank you very, very much.
Thank you so much. It was a pleasure and great honor.
Goodbye, everybody.
Take care.
Take care.
Whoa.